Welcome back, everybody. We continue on Miller and Brinson. It's always good when we have Dr. Stephen Grant here in studio from Iowa Sleep Disorder Center because the guy is so helpful. I mean, he helps me, he helps listeners, and, of course, he helps his clients that come and see him. How you doing, man? You all right?
Good. Great to be back. I'm doing well.
Nice to have you.
How are you?
Here. I'm fabulous, to be honest
Getting
with you.
enough sleep?
I'm working on it. The bed I'm in right now is totally uncomfortable. Doesn't work for me. I got to get a different bed.
Okay.
Okay. Other than that, I'm good.
All right.
But I know I've talked to a couple of guys that I played golf with over the weekend, and they were complaining because they're not getting enough rest. And I said that, hey, look, I know the doc's coming in. And I asked him, I said, what do you want me to talk to him about? And they said, well, my kids are going back to school. He says, I can't get them to bed at night. And I said, what do you mean? He said, well, I want them in bed by roughly 10 or so, 9:30, 10 o'clock, and they're still up till midnight because that's what they were doing during the summer. What do you tell them?
Well, I think we're in the sweet spot right now for kids getting back to school and trying to break a summer routine and get back into a habit of getting up early, trying to catch a bus or get to school prepared and appropriate. And it can be a challenge to get kids out of that sleeping habit of staying up late and sleeping in. One thing I find almost universally is an underestimation by a lot of parents about children's sleep needs. And when I say underestimation, I would very carefully state that even 8 hours is sleep deprived for a 7 to 10-year-old. That demographic typically needs anywhere from 9 to 10 hours of sleep. So sometimes a lot of people get it stuck in their head that 8 hours is this magic number, but in children they need well more than that. And cumulatively, sleep debt can add up and affect these kids, affect how they perform in school as well as their behavior.
You talk about that, and when adults don't get enough sleep, you and I both can identify with that. I mean, we look tired, but we go about things like we normally do. We drink more coffee, or we'll go get an energy drink or something like that to keep us rolling through the day. What do kids do? They're not, a 10-year-old's probably not going to go get a cup of coffee.
Yeah, sleepy kids don't act like sleepy adults. We know this, and they certainly should stay away from caffeine or wakefulness-promoting agents. If anything, Jim, it's almost paradoxical. They look hyper. They have a lot of energy. In fact, a lot of the cardinal signs and symptoms of ADHD can almost be clearly mimicked by sleep deprivation in children. Kids won't act like adults and appear sleepy. Oftentimes, it'll almost be the opposite.
How do you recognize that? I mean, do they just are bouncing off the walls, or they're not doing their homework at night, or are they disruptive in the family? How do you identify that?
I've seen a fair number of pediatric cases of children that have been diagnosed with attention deficit hyperactivity disorder that have not had ADHD but are chronically sleep deprived and have parents that believe that 7 or 8 hours of sleep should be more than enough for their children when in fact it's not. We try and quantitate children's sleep. We have a device called an actigraph that we can put on a child. It's a small, unobtrusive little wristwatch that we have your child wear for 2 weeks, and allows us to kind of objectively measure when they're going to bed, how quickly they're falling asleep, as well as what their overall sleep architecture looks like. Because it's real hard. I mean, even I'll challenge you. Do you know exactly how long you sleep each night?
No.
Or when exactly you're getting to bed or getting up?
I go to bed at different hours every night. I mean, one night I might go to bed at 11:30. The next night it might be 12:30. Then it might be 10:30. I'm not in a
inconsistent.
I am inconsistent. I knew you were going to beat me up over that one.
Yeah.
But aren't kids like that too? I mean, if they're tired, don't they try to go to bed at 9 and then the next night they're up till 11?
Well, we hope not. I mean, we want to keep kids on a very regular, predictable schedule. Top 3 things in getting kids on a good sleep-wake schedule is routine, routine, routine. And you can't sometimes have a lot of bearing on when kids go to bed. In other words, force them to fall asleep. But you can certainly have a bearing on when kids get up and try and enforce a very clear wake time and allow their own body's endogenous or natural sleep mechanisms to help these kids get to bed at an appropriate time.
So you don't want to give them anything like some sort of sleep aid or anything like that?
Well, this is an interesting point, Jim. There are no FDA-approved sleeping medicines for people under the age of 18, children. There is no pediatric-approved hypnotic medicine.
Wow. So if somebody was going to do that because they were struggling trying to get their youngster to bed, they shouldn't do that.
You're going outside of the box. And I think to any pediatricians out there or people that deal with children, they're very circumspect, very cautious to even recommend sleeping medications on kids. A lot of kids will have what we call paradoxical effects. I'm sure you've run across people that take Benadryl, or the other name for it is diphenhydramine. It's an allergy medicine. It's an antihistamine that makes the vast majority of people tired. It's the ingredient in Advil PM or the Tylenol PM preparations. That's just that medicine with Benadryl. And there's a fair portion, the vast majority of patients that take that get tired. But there's not an insignificant amount of people that take diphenhydramine or Benadryl and become really activated, almost like an upper.
Really? So it can have the reverse effect on you. Then.
Exactly.
All right. Now, I've seen things on that, and just to follow up, because now we've established that you never ever give that stuff to your kid. But if you're an adult and you take that, is that a bad thing if you're taking like a half a pill a night or a pill a night just so you sleep better or not?
Well, it's certainly, I think there's always an indication for sleeping medications in the right type of clinical scenario. Certainly, again, when you're using medicines like Advil PM or Tylenol PM, you're going a little bit outside of the box because they'll implicitly state that it's not to be used as a sleeping medicine, but that it will help you sleep.
Yes.
I mean, they kind of skirt the line there a bit, but if you look very clearly at the labeling on those medicines, they're not designed as a hypnotic, although they're clearly used for that purpose.
I got to confess then. Don't yell at me, Doc, okay?
I won't yell at you, Jim.
Okay, good, thanks.
You're safe here.
I take a half one every night. It helps. I mean, I'm gone.
Yep. And I think, Jim, that there's an old concept that I learned from a pharmacist friend of mine. We call it Obikelp, and that's placebo spelled backwards. That if somebody really believes that an external event such as taking this pill produces sleep, there's this association that's born of it. And honestly, if I could slip a Tic Tac in there and give that to you, but with enough convincing that this
you think it's in my mind?
Well,
I'm one of those guys that could be like fooled by the FDA.
The placebo effect is extraordinarily strong.
Wow.
Often underestimated, especially in sleep medicine.
Okay. Are you telling me I should kick the habit and try something else?
Well, in the end, you just kind of take a look at risk-benefit, and you say to yourself, hey, every night I take a half of this pill, but I'm able to sleep and I'm able to wake up and function. But some people, when we look at the usage of sleeping medicines, get into some bad habits like escalating their doses, not taking a half a pill, taking a whole pill, 2 pills, 3 pills, 4 pills, or still having insomnia problems despite taking medications. And that's when you kind of have to hit the pause button and really try to understand what's happening here or what's really going on.
Okay. If I'm fortunate from that standpoint because I never take more than the half.
There you go.
Okay. So I'm good. Okay,
You're good like that.
Okay, I'm good. All right, let's go back to the kids then, and then we'll wrap things up because I just found that interesting when you got onto the sleep aids at night. So, A, you never give a sleep aid to a youngster.
There are no pediatric-approved hypnotics.
Okay. And so if your kid is a real struggle, I mean – so somebody brings their son or daughter to you. How do you quickly establish what you can do for them?
Well, it kind of frames back to getting an accurate history about what the child is actually doing. Identifying if there's any bad sleep hygiene, if the child is napping at all during the day, that will decrease their ability to be able to fall asleep at night, as well as really understanding what their sleep-wake patterns are and their sleep environment. Making sure that there are no Xbox games or texting devices near the child. It's surprising to me the number of times where I've put the Actigraph watches that I spoke of earlier on kids, and you get the history from the child about what their sleep-wake schedule is versus what the Actigraph shows. It's almost like Colbert's truthiness meter. It really does give you very clear empiric evidence as to what the child's doing with respect to their sleep versus what the child is telling the parent or even what the child is telling the clinician.
I always, and this is going to sound like I'm just slurping for you here, but I don't mean to, because every time you come in, I always learn something good.
Well, thank you.
I mean, it's amazing to me, and now I know that if it's in my mind about that half a pill, that sleep aid that I take at night, and I take Advil PM. That's what I take, and I'm out like a rock, and then I wake up and I feel good. All right, but if I put a Tic Tac in there, and just had it in my mind, I might get the same result as what you basically have told me.
I would humbly suggest that could be plausible.
Dr. Stephen Grant, I'm a sleep disorder center. It's always good, man. Thank you.
Thank you.